Yeah, sure. So it was exciting to chair the education session for MDS. We first hear about prognostic and molecular classifications that have changed. We then get to hear about lower risk therapies, and then really the focus of my session is high risk MDS. And we've been stuck with Azacitidine for over 15 years now. Can we move past? And unfortunately, it's still an open question. So I think really what I go into is I think we have to personalize the treatment of our patients more. Treating an all-comer high-risk MDS patient population going forward is probably not the most optimal strategy. And I think the one big group of patients we need to separate out is the P53 mutant group. Really, with all standard of care therapies, this group has done significantly worse. And so I focus on ways to identify them, some prognostic differences that you can see based on variant allele frequency, allelic status, et cetera. And really that, although transplant is a curative option, we really need to think about how optimally to get them there. We've had a lot of struggles in frontline options, and a lot of the critiques have been trial design, heterogeneous patient populations, including patients with other disease, not looking for overall survival. And so really there have been 3 large randomized phase 3 trials that have finished accrual. I've been fortunate to help lead the Magrolimab efforts, and then I think the big setback, just a couple months ago is that this did press release to be negative. The data have not been presented, and I think the big question is what is the changes from phase 1 to phase 3? Again, do we need to make the eligibility characteristics different? Do we need to think about treatment differences across the group? So still a question on what happened there. I think the big excitement potentially is with Venetoclax right now. We're all waiting for the phase 3 Verona trial to read out. And both in large phase 1 studies and then real world data that we've recently published, response rates have been in 80% of patients, true complete remissions over 30%. And we're hoping that the trial can be positive, but it can cause a lot of toxicities, and there's still concern in the MDS field, will we have a positive phase 3 trial? But I still think the horizon is quite bright thinking about that group. We're also waiting on the readout of the phase 3 Sabatolimab Azacitidine trial. And the only ongoing accruing trial is a phase 3 trial with Tamibarotene, which is for RARA overexpressing patients. I think going forward, we need to potentially better think about synergy resistance mechanisms. I think we need to incorporate measurable residual disease into prospective trials. And again, hopefully we'll be changing the standard of care soon, but the jury is still out on that.